To do. Brought to you by
Mike's Got Plumbing. If water runs through it, we do it.
Holy what have you done in my kitchen?
Oh, honey, how is it? I never know when she's coming home.
What are all these pipes laying around? Why is my dishwasher in the living room, and why is the carpet all wet?
Well, remember that fancy new kitchen remodel you've always wanted?
Oh, I do, and this is not it.
But I thought I might save some money by doing it myself.
You thought wrong. I promise this is going to cost you way more. You should have called in the professionals at Mike's Got Plumbing, because I'm pretty sure when I flush the toilet, water is not supposed to come out of the sink.
Noticed that, did you?
The next thing I'm going to notice is you calling Mike's Got Plumbing like you should have done in the first place.
Yes, dear. 866-314-4443.
Yes, 866-314-4443.
That played out so differently in my head.
on next week's episode of What Not to Do.
No, not monkeys.
Now you did it. Are you completely insane? He's back. He, who must not be named, the man, the myth, the only guy in Ocala to eat his own weight in fried pickles. Twice. Now, you asked for it. Sorta. Live and in person, it's Tom Schmitz.
Welcome back to Ocala Talks as we wrap up hour number 1. May is Bladder Cancer Awareness Month, and while many instances of cancer are on the decline, incidences of bladder cancer are expected to rise this year, with an estimated 83,000 plus people in the U.S. to be diagnosed in 2021. Let me put that in smaller numbers you can understand. That means almost 300 people a day will hear the devastating words, "You have cancer," due to bladder cancer. On the line with us now is oncologist Dr. Alicia Morgans. Doctor, good morning to you.
Good morning to you. Thank you so much for having me here and for highlighting Bladder Cancer Awareness Month.
You know, it's one of those things that a lot of people, your bladder works. You go to the restroom, you use the restroom, your bladder's doing its job. What are some of the signs that you might start seeing as a person to say, maybe I need to talk to my primary physician?
That's a great question, and I agree with you. As long as your bladder is making urine and you're able to pass it, usually people think that you're just fine. But when you have blood in your urine in particular, even if it's just a little spotting one day that seems to go away and not bother you again, that could absolutely be a sign of bladder cancer. And importantly, bladder cancer is a type of cancer that can be more silent than not. So if you see something like blood in the urine, or for women, if they have recurrent urinary tract infections that just don't seem to be going away despite antibiotics, these are things that you need to talk to your doctor about and investigate further.
Is bladder cancer, does it have a gender that it likes more than another, as bad as cancer is, or is it evenly spread across the female and male genders?
It actually affects 3 men for every 1 woman, which is important to know, and is associated with exposure in many cases to smoke, whether it's secondhand or someone smoking himself or herself. So these are the people that I usually consider to be at highest risk.
You know, you hear about, like, I had my colonoscopy a year and a half ago, got my 10-year clearance, so my prostate, they say, is in great shape. But it's not one of those things you hear a lot about. When is it that we should start? Is there a time you should start worrying as you age about bladder cancer, or is it something that can affect anybody no matter what age?
Well, importantly, the things you mentioned, colon cancer and prostate cancer, have screening tests like a colonoscopy or a PSA that we can use to identify these cancers early. With bladder cancer, we actually do not have a screening test. There's no blood test. There's no way to identify it just by, doing an annual test at your doctor's office. So it's really depending on us as individuals who experience things like blood in the urine or pelvic pain or these recurrent urinary tract infections to speak up. And that is actually one of the reasons I'm so excited to partner with CGen and Astellas on the Let's Talk About the Tough Stuff campaign, which raises awareness for patients, for loved ones, that it's important to talk about these signs and symptoms that our body's experiencing, no matter how embarrassed we may feel, because that's really the only way we're going to identify the cancer in the first place, because there really isn't a test, and your doctor will not know when you come in for any other reason unless you tell him or her.
Why do you think, from your experience with patients, why do you think that talking about your bladder and how it's working or your pelvic area, why is that such a tough conversation?
That's a great question, and I think it's just a bodily function that we don't necessarily routinely bring into conversation. We don't sit around at dinner saying, oh, I urinated really well today. That's
No.
just not something that we typically do. So, these are things that can be tough simply because of the subject matter and the way that we don't speak about it. And that's true actually before we're diagnosed with something like bladder cancer, but often it's also true when patients are undergoing treatment for bladder cancer or when loved ones are experiencing distress related to bladder cancer. We need to talk about these physical symptoms, the mental distress we experience, because that's really the only way that we can get help for those problems.
One of the things that when you were talking about that and how people don't talk about it at dinner, one of the thoughts that came into my mind is I've never had the conversation with my doctor about strong stream versus weak stream. Is that a sign that there may be something wrong, strong stream versus weak stream?
Not usually related to bladder cancer, but it is absolutely possible that could be affected, especially as I said with blood. But the strength of your stream can be affected by your prostate, and as a man, that's something to definitely consider discussing with your doctor, because there are multiple things that can be problems with our urine. That if we identify them, bring them up, maybe we can help cut off certain cancers at the pass and make sure that they don't become bigger problems later.
You talked about UTIs, urinary tract infections. That's something, if you ask a guy, I would bet he says, yeah, that's something a woman suffers from. We don't get UTIs. How wrong is that for a man to think that?
Well, actually there's some truth to that. That's exactly why it's a problem. So more women get urinary tract infections just because of our anatomy, which
Right.
of course is very, very different. And so women are predisposed to getting these. Men, if they get a urinary tract infection, might have something bigger going on. So they can get these infections. Anything can get infected in anybody in the right circumstance. And sometimes the circumstances related to developing a bladder cancer are what puts you at risk for developing a urinary tract infection as a man. So if you have symptoms of pain with urination, if you have lower abdominal and pelvic pain, this could be a urinary tract infection and should be checked out by your doctor, especially if there's any sign of blood, even if it's short-lived and goes away.
I know that, one of my favorite actors, Patrick Swayze, he died of pancreatic cancer, and it just all of a sudden happened, and he was done. I know early detection of bladder cancer is probably a good thing, but is this a cancer that if it's detected early enough that has a very good survival rate?
Absolutely. And the key there is detection. So talking with your doctor about blood in the urine is part of that, or any other symptom that you're concerned about. But a majority of patients with urothelial or bladder cancer do get diagnosed at a stage that can be treated and cured. It's only some of the less common instances where the cancer is actually invading into the wall of the bladder itself or has spread, where it can be more difficult to cure. So most patients can be cured if we identify it.
Talking with oncologist Dr. Alicia Morgan's talking about bladder cancer. It is Bladder Cancer Awareness Month. The tough conversations you're talking about with the Let's Target the Tough Stuff campaign, what are some of the questions, when you say tough questions, what are some of the questions that patients may think are tough to talk to their doctor about?
Well, we talked a little bit about the blood in the urine and urinary tract type things that can be hard to consider talking with your doctor about and can lead to diagnosis. But after diagnosis, patients may find that it's hard to ask questions about what their treatment might look like, whether or not they'll need surgery for their bladder cancer or chemotherapy, and what the side effects of both of those treatments might be. These, of course, are things that patients will want to plan for and of course, have questions about and deserve. The patients who have these questions absolutely deserve to get answers so that they can plan and prepare for how to deal with these complications. There are also questions that caregivers might have about how to best support their loved ones, which are critically important, and that's addressed on these YouTube channels for Let's Target the Tough Stuff. And finally, I would really emphasize that some of the hardest things for us to talk about are things related to mental health, depression, anxiety, and sexual health, because again, these are not things that we necessarily as a culture talk about on a daily basis with a lot of people. But these are absolutely concerns that deserve to be addressed and can be addressed if we empower ourselves by watching things like the Let's Target the Tough Stuff YouTube channel to really get ways or ideas about how to ask these questions and how to feel ready to talk with our doctors.
Dr. Alicia Morgan, thanks so much for joining us and talking about this very serious subject.
Thank you so much for having me.
We'll be right back after this timeout. Robert Colin from On Top of the World. Coming up next, 1370 AM, 96.3 FM, WOCA, The Source.
Broadcasting from the Ocala International Airport, this is WOCA.